Hello, my name is
Hi.
Hannah.
Hi.
Can you just confirm your name and date of birth for me, please?
Jeremy 1-1.
Okay, great, thank you. Okay, so you're here for an athletics assessment, correct?
Yeah, that's correct.
And I see you noted in your paperwork that you were having some trouble getting your heart rate back down after extraneous exercise.
Yeah, a few times that's happened.
Okay, and for how long has this been going on?
Maybe the last couple weeks.
Couple weeks, okay. And when have you noticed this? What type of exercise? More cardio, weightlifting, sports?
Yeah, running.
Running, okay. And how long are you running mile-wise per time?
Maybe like 3 miles.
3 miles, okay. And is that normal for you? How long have you been doing that?
Somewhat normal.
Okay. And so 3 miles for the last couple of weeks. How many times has it happened where you felt like you couldn't really get back to a normal heart rate?
Maybe like 3 or 4 times.
Okay. Out of how many?
Maybe 5.
Okay,
6.
so pretty often.
Yeah.
Okay. Good. Are you having any other health issues at this time that you can think of? Any stomach upset? Any headaches?
Nothing else really, no.
Nothing, it's just that. Okay. Are you noticing it's hard to catch your breath in addition to your heart feeling like it's pounding, or do your lungs feel okay?
Maybe a little bit, yeah.
A little bit, okay. Alright, we definitely want to get that checked out, make sure everything's okay. I'm also going to do a full head-to-toe assessment on you. It's just important that we check out everything that could be causing any issues and make sure you're healthy otherwise, okay?
Perfect.
Okay, so I'm just going to go ahead and grab a few things and we'll start the exam.
Sounds good.
Great. So first thing I'm going to do is just sanitize my hands. And I'm going to have you slightly open your mouth and put this under your tongue. You can just hold it there. While you do that, I'm just going to take your pulse. Okay, good. Okay, 97.6, very good. Alright, I was also taking a look at your respirations there as we did that, and I would say that they're very normal, so we'll take a look after we do some physical activity and compare, okay?
Okay.
I'm going to go ahead and get the blood pressure reading.
Mm-hmm.
Do you have an arm preference?
No.
Okay, go ahead and stick this arm out for me. Make that a touch tighter. Is that okay?
Yeah.
Okay, great. And just gently put your hand down there. Nice and relaxed. What we want to do is just get a baseline reading. That way we can see if you're actually having physiological symptoms in addition to that feeling of heart fluttering. So it's just going to get a little bit tight on your arm. Should feel uncomfortable, but it shouldn't hurt, so let me know. Okay. This is 128/65, so that's very good pressure. So so I'm just going to start going head to toe now. I'm going to do a full assessment before we do the activities. That way, if anything else pops out, I'll make sure to pay attention and retest that thing after the activities, okay? All right. I'm just going to take a look at your skull. Just palpate. Is there any pain when I'm touching you here?
No.
Okay, feeling for any lumps, bumps. Just going to do a quick check in a couple of places. Looking for any signs of trauma, in case you perhaps hit your head while you're running. If you fell and got a concussion, you may not always remember the incident, but that could affect how you're feeling. Everything looks good. Okay. Right, I'm just looking at the distribution of your eyebrows. They're even, symmetrical. Your eyelashes are full. Can you look down for me? And up. And side to side. Any dizziness with that movement?
No.
Did you lose any vision or have any blurriness while you're doing that?
No, I didn't.
Okay. Go ahead and look at my finger here. I'm going to move it in a couple different directions. Follow it with just your eyes only.
Okay.
Okay. Any dizziness or double vision with that?
No.
Okay. Go ahead and look straight at my finger. And now look past me at the wall. And back at my finger. And follow it all the way in. Very good. Okay, I'm just going to take a look in your eyes with the light.
Yeah.
So look straight ahead. Just ignore me. I'm just going to check to see if your pupils are reacting. Very good. I'm just going to check for a red reflex. So just again look straight ahead. I'm going to check the other side. Good. And it reflects in the same place. Excellent. Okay. I'm just going to move on now to your sinuses. Any pain when I touch here?
No.
Anybody here?
No.
Okay, good. Look into your ears. Have you been having any trouble hearing?
No.
Okay. Good. I'm just going to make some soft noises next to your ears. Close your eyes for me, and then tell me where you hear it, right or left.
Right. Left. Left. Both.
Great. Okay, that sounds great. So your hearing seems to be totally intact. If you had more hearing loss, any hearing loss symptoms, you can just come in another time, let me know, but everything looks good. And take a look at your nose and you gently put the tip up. And when you run, are you breathing through your nose generally or through your mouth?
Usually through my mouth.
Okay. So do you find that it gets hard to breathe through your nose sometimes?
Sometimes, yeah.
Okay. Have you ever suffered do you run inside or outside?
Both.
Okay. Do you feel like it's worse outside or inside? Or does it seem the same?
Pretty much the same.
Okay. Go ahead and breathe in. And on this side. Okay, definitely a little occlusion on that side. So it could be that when you start running faster or having more aerobic behavior, that you're not actually taking in as much oxygen because one of your nostrils is occluded. But since you breathe through your mouth, that may not be the issue. So we'll just keep an eye on it.
For sure.
Clench your jaw for me. Good. Okay. One more time. Good. All right. I'm going to test some of the sensation in your face. Make sure you're feeling things symmetrically.
Okay.
So I'm going to touch you on, have you say yes when you feel it, and then I'll ask if it's the same on both sides, okay?
Okay.
All right. So.
Yes. Yes.
Was that the same on both sides?
Yeah.
Okay.
Yes. Yes.
And the same there?
Yeah. Yes. Yes.
Same?
Mm-hmm.
And you feel that on the tip of your nose?
Mm-hmm.
Okay, excellent. So I'm just going to put some gloves on to look into your mouth. Just open up for me. Can you say ah? Okay. Tongue looks good. Your uvula went up. And do you have any, go ahead and close. Have you had any issues feeling dryness in the back of your throat?
No, not really.
Okay. Didn't look red at all, but sometimes when we're taking in more air, we can irritate our throat as well if you're trying to get breath in. Okay. I'm just going to feel your lymph nodes for any swelling while I'm here. Can you shrug your shoulders for me? Okay, good. I'm going to check the ones under your arms as well. Okay. Didn't feel anything there. So that's good. Definitely seems to be like if you're having some trouble catching your breath. I'm not thinking it's coming from sinuses or from any sort of tonsil swelling or anything like that. Alright, so I'm just going to go ahead and move down to your chest, and that's going to involve me listening to your heart and your lungs, okay? Okay. I'm just going to start out with your chest on the front, so go ahead and take a deep breath for me. One more. Can you lift this arm for me? Take a deep breath there. And one more. Okay. Any pain or discomfort on that side?
No.
Okay. Go ahead and take a deep breath. Okay, good. Sounded a little bit less clear than I'd like, but nothing that would suggest that you had pneumonia or any sort of water in your lungs, but definitely could be a little bit congested. So I definitely want to do some further tests as far as breathing goes, but we'll also recheck this after exercise. So now I'm just going to listen to your heart, and you can just go ahead and relax, and you don't need to breathe or anything special. You can breathe normally. That all sounded normal to me. So again, we'll recheck it, but it sounded okay for now. I'm going to have you swing your legs to the side here. I'll move my things out of the way. And I'm going to get the back of your lungs. Just go ahead and swing your legs outwards. That's perfect, just like that. So again, just deep breath every time if you feel me touch you. Okay. Yep, same thing, just a little bit of cloudiness in the lungs, but nothing I would be super concerned about, but something I definitely want to check again. So I'm going to go ahead and check for lung capacity. So go ahead and breathe out all your air. Take a nice deep breath. And you can let it all out again when you hit it up. Alright. Excellent lung expansion, equal and symmetrical on both sides. I'm going to check for some tenderness here. Does that hurt at all?
No.
That hurt at all?
No.
Okay, that's good. His kidneys are probably fine. Okay, you can go back ahead and swing back around for me, please. Just going to check for your reflexes on the top half of your body before we move down to your lower. go ahead, go nice and floppy. Just let me take all your weight. Okay. Good. Good. Okay, same thing on this side. Give me all your weight. Okay. Go ahead. Just let me take your weight like this. Yep, exactly. Good. Good. Okay. Last thing I want to do is just some range of motion and some strength testing to make sure you're not experiencing weakness anywhere else in your body, okay? We're going to start with your hands. Go ahead and you flip them up like this. And can you go down? Can you go in and out? Okay, and I'm going to do that with some resistance. So hold your hands up like this. Don't let me push you. There we go. Perfect. All right, now I'm going to have you go ahead and put your arms up like this. And can you go them down? Extend. Okay. And I'm going to do the same thing with just some pressure. Resist me. Resist me. Good. And up like that. And down. And can you resist me? Very good. Okay. No pain or issues with that?
Not really.
Are you feeling any aerobic discomfort after that?
No.
Okay. It's probably not, threshold's probably not high enough to get your heart going.
Mm-hmm.
Okay. All right. And I'm just going to have you twist on the table if you can. Good. Any issues with your spine?
No.
Just look that way for me, please. I'm just going to take a look at your spine. Any pain when I touch here?
No.
Okay. All right. Looks good. Okay, last thing I want to do is just quickly check the sensation of your upper arms.
Mm-hmm.
So again, just say yes when you feel it and close your eyes.
Yes. 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 Yes.
Good. This side.
Yes. 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 Yes.
Good. Okay. Can you go ahead and do this with your hands, moving your... Good. Like this. Don't let me pull you open. Good. Okay. Go ahead and set that down. So I think that, we don't need to go into any more neurological exams because you seem to be intact. You're not having any memory loss with the fatigue. So let's go ahead and move down to your lower extremities, do some strength and range of motion, and then we're going to go ahead and do the physical test, okay?
Sounds good.
If you can just go ahead and uncross your legs for me. I'm just going to start with your reflexes. Good. Relax. Good. On the side, that's nice and loose. Just completely relaxed, exactly. Good. Nice, relaxed. Okay, good. Not quite as strong of a reflex on that right side, but is that normal for you, or have you always had stronger reflexes?
I'm not really sure.
Okay, we'll keep an eye on it, just in case. Next thing I'm going to do is just the Babinski. So it's a little uncomfortable. I'm going to scrape this thing on the bottom. Just looking for your toes. Okay, good. Okay, they will go in, so that's normal. So while I'm down here, I'm going to do some range of motion. Can you go ahead and lift this leg up towards me and put it back down? Any pain there? Do it a little against resistance. Push me. Pull me. Good. And on this side, up and down. Push me away. Pull me towards you. Good. Your thighs, can you lift them up against my hands? Good. Excellent. And can you push them out? And push them in. Good. Last thing I'm going to do with your toes, just scoot back for me. And can you push your foot down and pull it back up? And again, resistance. Pull it back up on this side and back up. Okay, excellent. Okay, you can go ahead and relax, and no discomfort there as well. Okay, last thing I'm going to do is just that same sensation. So just tell me yes when you feel it. And just uncross for me, please.
Yes. 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 Yes.
Okay.
Yes. 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 Yes.
Okay, excellent. All right, so everything seems to be doing okay. I'm a little bit concerned about that cloudiness in your lungs, so I do want to do the physical test, and it's just going to be involving you doing a few push-ups. If you did push-ups, how many would be normal for you?
Maybe like 20.
20? Okay. So I'll have you do 20 push-ups, just something that will get your heart rate going, challenging enough, but not so much that it might actually trigger some sort of issue. And then we'll go ahead and just retest those lungs, okay?
Okay.
Okay, great. Okay, Jeremy, so how are you feeling now? A little out of breath?
Yeah, a little.
Okay. I'm going to go ahead and feel your pulse rate while I watch your respirations. Okay, yeah, your pulse is a little bit higher, but that's to be expected. I wouldn't say it's in abnormal range, but your respirations, it does seem like you're having a little bit more trouble breathing. I'm going to go ahead and listen to those lungs again. I know it might be a little difficult right now, but try and take a deep breath every time I touch you. Just gonna get underneath here. Okay, the other side. Good. Okay, I'm just going to check a couple spaces in the back. Okay. So I want to go ahead and do one more test because I am still hearing a little bit of occlusion in those lungs, a little bit of wheezing when you breathe in. And it's going to involve you just breathing into a tube as hard as you can. I'm just going to measure the amount of air you're actually expelling out of your lungs, and then may refer you for tests after that if I'm not seeing a result I'm happy with. Okay.
Sounds good.
So I'm just going to clean this off. Okay, so go ahead, take a deep breath in, push all your air out, just to clear out your lungs. Okay, I want you to hold this, take a deep breath in, and then blow out as hard as you can, okay? Good, okay. So that's going to log into the computer. I'm going to go ahead and look at the results really quickly, and I'll be right back.
Okay.
All right, Jeremy, so the levels are just a little bit lower than I'd prefer to see in someone your age and your fitness level. So I'm going to refer you for a chest x-ray. Make sure you don't have any fluid in the lungs. You could have just a little bit of a minor case of pneumonia or bronchitis, or it could just be severe allergies, but I want to make sure that it's nothing more serious than that.
Absolutely.
Okay. All right. Well, thank you for coming in today.
Thank
Sorry
you
you're
very
not
much.
feeling well, but we're going to get you checked out.
Thank you.